My name is Kirabo Suubi. I'm a gender economist with the International Center for Research on Women. I'm based in the Kampala office. I'm really glad that we've had an opportunity to convene different stakeholders from policymakers, people in the private sector, and NGO. Yeah? So what has come out very critical from this conversation, and as ICRW, we are undertaking a research focused on social protection, understanding what social protection measures benefit women in Africa, but specifically in Uganda, because that is not very clear. We don't have evidence around that. So that is what we are doing as ICRW at the moment. And we don't want this research to be just for the sake of research, but rather to inform policy and interventions for social protection, for the policy actors to better understand what interventions, what social protection interventions work for women, what do women prefer, and also for us to understand what are the challenges that policymakers face in putting together these policies and the interventions. So the conversation here today has been very critical, because what has come out is that everyone at least admits that although we have a legal framework around social protection in the country, we have the Social Protection Policy of 2015 and the recently launched Social Protection Strategy last year, we still need to do more, and more in terms of interventions that are informed by evidence. So this underscores the critical role that ICRW is playing in terms of generating evidence that is going to inform policies, improving the policies that are already in existence, but also informing others that need to be put in place to see that we have effective social protection measures. Yeah? But also there's been a call to action around generating evidence on the response shocks, yeah, that we have currently. We recently had some for COVID-19 during the pandemic. We had a situation in Chitezi, and there were some responsive measures that were put in place. But we don't know how effective these measures have been. And as ICRW, this is one of our roles. Now we are going to make sure that we generate evidence working together with the key actors in government, the policy makers, working with our other CSO partners and the private sector to generate this evidence and also advocate and lobby for better social protection interventions. We already have those that are existing, but they need to be refined. For example, we've been talking about the single social sector registry, where everyone in Uganda is registered who needs social protection. Yeah? And also the other thing that has come out is that Ugandans need to be protected throughout their life cycle. If a Ugandan is born today, we need to know that they are protected from birth to when they become a toddler, to when they become a youth, and then when they become an adult, and when they grow old. So we need to have measures in place that cover the entire life cycle of a Ugandan. And as ICRW, we are committed to generate evidence that is going to inform and support these policies and interventions.